Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome once again to the Path You Take podcast, where the path you take is the path you make. Today, I'm joined by a very special guest, brother. Welcome to the podcast. We have you finally here. Say Dhia. Assalamu alaikum wa rahmatullahi wa barakatuh.
Walaikum assalam. Assalamu alaikum. How are you, Hamad?
Alhamdulillah. Specifically, you as a guest, I've been very excited as soon as I heard the news. I said, you're coming
Thank
on.
you.
I was like, I'm
Thank you.
clearing the schedule's clear. Phone's on Do Not Disturb. Inshallah, I have you here, and I'm excited to have you here. Alhamdulillah. I know what you do professionally. I know a little bit about your journey through it, but I know the audience, a lot of them might not know. So if you don't mind starting off, just let us know what your profession is and then slowly get into kind of the journey and how you found yourself
hmm
practicing.
Yes. Assalamu alaikum. My name is Dr. Dhia. I am a general dentist. I am 8 years now in practice.
Mashallah.
I own my own business, my clinic, and I am a preventive dentist. Yeah, I went to here for school for the high school, and then I moved to Europe to Budapest, Hungary, and I did my dental medical doctor degree there. And 5 year
Hmm.
course. Then I had to come back here to Canada. It took me 2 years to go through the licensing
Yeah,
process, and started practicing it back in 2018. Now,
mashallah.
yeah.
I know from like, someone, let's say, listening and they just hear the story, be like, oh, okay, 5 years there, come back 2 years, sounds easy, but I bet it's a lot more difficult than what it sounds like.
It has definitely its challenges. You
Yeah.
kind of go through the process twice. You go through the process with your peers at the university.
Hmm.
5 years, you start from the preclinical, and which is the basic science is a human body, and then you get into the clinical part of dentistry. You brush among the different kind of
Yeah.
departments in dentistry, and then you graduate and you're happy and you're ready to
Yeah.
go. But then you go home or travel to a different country which don't really recognize your degree, and they every country has their own process
Yeah.
of how you could go and how could you be considered a foreign trained dentist. And Canada has two paths: has the 3 step
Hmm.
exam, which is the National Dental Examination Board, and it's offered every 4 to 6 months. You'd kind of go through it. You different um, first again basic sciences,
Yeah.
preclinical. Then you start with the cases and also the practical. There's a practical portion of it. And there's the other path where you could go and join university
Mhm.
for their third and fourth year, which is the accelerated. And yeah, I consider myself graduating from Budapest, then had to come and graduate from Canada to learn and meet the
Yeah.
Canadian standards. So yes, yeah, twice.
So what came into play when when you made the decision in the first place to, go to Budapest and start your journey in dentistry there? Um, were you considering different options, perhaps the more traditional way of finishing everything here? Like what was going through exactly through your mind?
Yes, yeah. So yes, there are a few options. So there was the option of staying here, doing a bachelor's,
Yeah.
and then applying. Canada has 6 or 7 dental schools, so those my odds are pretty like they're there, but they are low. Versus going to a country that does not require a like a bachelor degree prior to
Hmm.
entering, and in Europe that's the norm. Same thing in some countries in Asia as well. So Budapest, I happen to have some family friends that were have from there, lived there for a very long time,
Hmm.
and Budapest, which is in Hungary, has a very prestigious university, which is also like a teaching
Yeah.
hospital. So they offer an English program. So try to muster up the courage
Yeah.
and move away from home to a very
Oh
foreign
yeah.
country with a foreign language that I've never been before. I've only know that my father has visited a few times
Yeah.
and the family friends that we have. Um, but it turned out to be a very, very good decision. I was very happy with. the program
Yeah.
there. Very happy with the student life that I was able to create there, and I met really great people there as well. So so yeah, it was of course difficult and challenging to consider this, leaving home, leaving family, and going to a new place where there's a risk you
Yeah.
might be able to do very well, or you might find some challenges that sometimes are in within your hands to deal with, or even things that are out of your hand. But I was able to. I didn't find a reason not to um, put my faith in Allah, and I was like, okay, let's go. And if it's meant to be, meant to be, and it worked out. Worked out.
That's a
Yeah.
great mindset to have. And you're not the first guest to say it, alhamdulillah. A lot of people say just put your faith in it, just do it. Nike not a sponsor, but just do it.
Yeah.
Uh you just gotta take the step, and then, high risk, high reward. And again, sometimes you have some reasons not to, but you have reasons to do it. You had your support, your family supported you a lot
Yes.
throughout the
Of
journey, and
course.
they're
Hmm.
roaring for you and cheering you on. Alhamdulillah, that's a great thing to have as well. Just the family support system is a big
Yes,
thing.
definitely. Yeah, I like my beloved father. He is a general dentist
Mm-hmm.
himself, so he
MashaAllah.
laid out a very good example of what kind of life you live
Mm-hmm.
as a dentist, what kind of role you play in society, in your community, where people come to you for like for pain relief, for
Yeah.
help, and also you being the person you are once you are business owner. Once you are a provider, then you could also provide for yourself, and then you also could provide back to your community, help family, help all of that. So that was what kind of made me kind of realize that okay, this is maybe this path will give me this kind of life.
Yeah.
And then then I had to kind of dig deeper of like, okay, this path that I want to be, this day-to-day work that I
Yeah.
want to be, does that also suit me, suit my personality? That will I be able to kind of do well in that field? Because yes, maybe the work gives you the paycheck, and the paycheck sets your lifestyle in your
Yeah.
life. But then you could do different things for that paycheck.
Yeah.
And then I had to kind of find out and see, and that's when I was able to shadow a few dentists that we have in our lovely community as well, to get to see what's their day to day like, how are they, what is mostly their work. Because
Mm-hmm.
it's true, as a dentist, you are working with teeth on teeth, but outside the tooth, then you're dealing with people.
Of course. Yeah.
You're dealing with people's kind of pain, fears, anxiety, and trust.
Mm-hmm.
And when you're dealing with people's trust, when people come in trusting, like wanting you to trust, trusting in you, then you also have that responsibility to deliver in their best
Yeah.
interest. And Alhamdulillah, because the nice thing, or beneficial, the fruitful thing about medicine or healthcare is that your best interest is the patient's best interest. Or if you're justifying for the best, or justifying for the optimal health or optimal solution, then if the patient is on your side, and they also want the best, and they trust that this is the best thing
Mm-hmm.
for them, then it kind of goes hand in hand, and you're not trying, like you're it's something that allows them to end up with the best treatment and health for them. So it's not always kind of conflicting. Like if you're wanting the best for the patient, offering the best advice, offering the best options, doing them right,
Yeah.
um, then it kind of feeds that, like that positive momentum feeds what you're doing. So so I found that my personality, given my temperament, how I deal with people, how I listen to people, all of that allowed gives me is it's an asset
Yeah.
in dentistry, where it's because of the biggest part is that you need the patient to walk in and trust you. They don't need to know you. They
Yeah.
don't need to know your favorite place to ski in the winter. They don't need to know what you do, what's your life, and all of that. But if they do trust that you're a good dentist, that you're going to treat them in the best way, then that is That is the best service that you could offer them. Because sometimes maybe if they trust in you, then maybe you're not the right person for them, or you're not the
Yep.
right person for them to do this procedure, or this case is not good for you. So I feel like as a dentist, every person you could help in a way. It's not necessarily you're the person that's
Yep.
helping them, but you could lead them to where they need to go.
Working in good faith ultimately, right? And just
Exactly.
and at the end of the day, you're technically a doctor. You're helping people out, and
Technically, yes.
technically
More than
you are a
technically.
doctor. Tried to humble you a little.
Yeah.
You are a doctor. You've been through enough
Yeah,
struggle.
there's a lot of jokes. There's a lot of jokes out there. I just
No, you
wanted
are
to
a
say,
doctor, mashallah.
technically, we are. Yes.
Yes,
Yeah.
you're a healthcare professional. I don't like dentists too much. I always have just when I was younger, I had some bad experiences. Every
Yes.
time I go there, I was,
I won't blame you. I don't blame you.
it's
I wouldn't like people this close
oh
in,
no, I
in
had
my
the
in my
worst
space.
dentist as a kid, man. The
Okay.
very worst. Like if I tell you my experience, you might be. He was an older gentleman, so he didn't really have too much, but he was professional. His professional thing was he deals with kids.
Yes.
He's okay. So I was younger. I think I was like what 8, 9 years old. It was my first time going to the dentist, and I was getting some cleaner, some fillings. I don't remember what it was. And I was younger, and I'm a shorter guy, so I was just a little bit smaller, and my mouth could only open so wide,
Yeah.
open wider. And he's like, "You have to go," and he was shouting, "You have to go wider, and you have to go wider," and he was like just ranting. He was all angry and just
Yeah.
bumbling, and it was just a horrible experience at such a young age. And ever since then, I was like, whenever I have to go to the dentist, and my mom has to book me the appointment. Yeah, at this age, it's
Till
my mom
now.
or my
Till
wife
now.
who books me the appointment. She's like, "You have to go," and half the time I cancel the appointment,
Yeah.
even though I got some cleaning done. I feel like it's just that the first couple experiences were just horrible,
Yes, and that's
and
actually
it's
like, and the industry, once they started kind of
yeah,
realizing how bad experiences when you were a kid, how it kind of shapes your relationship with your own teeth. The way that we do things now is way different than how it was done,
yeah,
and the way that I only work on kids that allow me or
mhm,
let me and stuff. And yeah, I book them extra time. I do less of the work than I'm usually, like, I slow down my treatment work, because working with a very young child is like working with a very old
yeah,
person.
yeah,
And I see both ends of that age spectrum. And again, it's about patience.
of
It's
course, yeah,
about trying to kind of being patient centric. It's all about being patient centric, and having, how could you make your patient's appointment their best
yeah,
appointment. Because we get a little bit caught up in our day to day, or in the
we're
day
all
in the
human at the end of the
appointment.
day, yeah,
Exactly. And our schedule, sometimes there is more important
mhm,
appointments in the schedule every day. Bigger appointments, more important appointment, more profitable
yeah,
appointments, all of those kind of things. But sometimes you do have a short appointment of someone that is coming to just check some
yeah,
pain or sensitivity. To me, when I'm looking at it, that's just a small block in my
mhm,
schedule. I'm gonna go in, see what's up with the tooth, and leave.
yeah,
Because that's usually the process, is that diagnosis, then treatment, then follow up. But to that person who has booked and was been in the schedule for like 3+ weeks, might have been dealing with this pain for X amount of
yeah,
years, very anxious about this appointment, all of those kinds. So imagine this person, that's their life, what has gone in their life until they actually walked into my
yeah,
office, and where they are emotionally, where they are kind of mentally, versus me, that if I kind of get too caught up and not care as much, or not
yeah,
look or give my full attention to this person, or care, it won't meet
yeah,
any expectations. So again, it's all about bringing being present, looking at every point, like time. Because in Canada, the dental industry, it's about kind of the provider jumping from one chair to another.
yeah,
It's about seeing, about it's all about efficiency, how well you could do, or how many people you could see. So you're in within that same hour, you might see four different people. And you have to kind of go back and forth. You see people for their recare appointment,
yeah,
and in
yeah,
the hygiene chair, and all of that. So you are mentally could be go into more than one area. And if you don't bring yourself back to the every present moment, then sometimes you might disappoint people and not fully give them the why they're here for. Like
Yeah.
again, it's they might be to them how important this is the very so back to what we were saying that every appointment you have to try it at if it's the most important appointment of the day,
Yeah.
whether it is the just a like a just a post op or like a just checking in on them, or if it's a small little recall appointment, or if it is an implant, like all of those. And the easiest way to do that is just being a little bit more present,
Yeah.
bringing yourself back to where you are, and just kind of just again back connecting with that person that's sitting in the chair.
That's beautiful. That's a beautiful way to put it. I'm not scared of you. Don't worry. It's totally fine. And
So we could
you never know. Yeah.
we could always change that position that you have
Yeah.
from dentists, um because I think now you could book your own appointments.
Yeah. Hopefully in the near future. Not ready yet, but I am seeing the dentist soon. So currently, I'm happy with my dent. In case you're seeing this, I love you. It's great. They're nice people. They're great. It's
Nice.
just
It's good. It's good
just
to
getting
have
the
a quick one.
appointment is for me calling in and
Yes.
then getting in there. Once I'm in the chair, I'm at their mercy, so I can't do
Yes.
much. I won't do much. Um, what I was gonna ask as well. Enough talking about myself and my
Yes.
personal trauma. It's not therapy. I'll go to therapy after this. But I want to ask you was you going abroad and studying abroad, what were some of the obstacles that you faced that you're willing to share with the audience in case there's someone who wants to follow a similar type of path where they go abroad, they do dentistry out there and they come back and then, but maybe they're not too sure of some obstacles that they don't know that might come up that
Mm.
maybe you didn't really take into account and came up in your journey as well.
So I think the biggest obstacle is usually the first year when you move, where you're
Yeah.
somewhere new in a new environment and setting that new kind of circle that you have. Whether it's like a study circle, whether it's a study
Hmm.
social circle, or just connecting with people that say same language and color as you, just to kind of like feel the same person that you really are. Um, to my advantage is that you're joining a first year program where there are other everyone else is
Hmm.
also a first year entering this. So thing that goes on to in your way is that everyone wants to find their circle, everyone
Hmm.
wants to be kind of familiar and friends, so that is good. But in the beginning, in that uncertainty, or even those first few encounters, the people that you meet and stuff, it's are you gonna like them, are they gonna be good, are you gonna trust them, all of those kind of things. So you do need to put yourself out there, you need to extend an invitation to kind of study together, meet together, all of that. And you might not be that personality. Maybe back home where you are,
Hmm.
you weren't that person.
Yeah.
Maybe you were the maybe you were the invitee and not the inviter. And then for you to become a new, or like build a new kind of facet of yourself, like a
Yeah.
new kind of angle of yourself. And that is challenging, and that is where you might not ever kind of DM just a random guy and be like,
Yeah.
"Hey, you want to go for a meal?" You might be more inclined to do that in a new country,
Yeah.
in a new place where you're like, "Okay, well, if I don't, I you," because we like to connect with people. We
Of
like to be
course. Yeah.
part of a community.
Especially when you're going through the same struggle as well. You guys are on the same journey, right? So
Yes,
you want to be
exactly.
together and go through the struggle together, right?
Exactly.
Yeah.
And the biggest part is that you come with an identity,
Yeah.
and you also want to hang on to that identity. So whether it is your favorite team you follow, or if it's your like religious practice,
Yeah.
or if it is certain kind of sports that you play, all of those kind of things, you kind of don't want to let go, because you don't want to like recreate or reinvent.
Hmm.
And the older you are, the more there's a higher chance for you to have challenges. When I moved, I was 19, so still consider myself young, so that I'm more likely to kind of
Of
adapt
course. Yeah.
or that.
Yeah.
But we had people that started the program and they were well in the middle of their 20s or
Hmm.
late 20s, and it is it's you could find more challenges the older you get. So that's from the kind of community where you're worried, you're like, am I gonna find friends? Am I gonna find people that I'm gonna be, or am I gonna be alone? Because the alternative is being alone.
Yeah.
And the hardest thing is to be somewhere and have a life in a different
No,
country.
yeah.
It's like, so if lots of people that moved to Hungary kind of stayed really well in tune with their life back home,
Mhm.
whether it's the sports that they used to
Yeah.
watch, the team that they follow, or maybe like every time there is a holiday to just fly back or like
Yeah.
go back in there and stay friends with their old friends
Mhm.
and not really integrate well in the new place.
Mhm.
And you do need to integrate in the news place. Like those people that you're going to be seeing in the next 4 to 5 years every day, those, if you work on those relationships, they're going to end up benefiting you
Of
more
course,
than
yeah.
you trying to hold on to friends back home that like you're now on like on a different pace. Every time like you fly and then you fly back in the summer, everyone, you feel that everyone is in a different place. You haven't lived the same place, or
Yeah.
you feel like, oh, I moved a year somewhere else. If it's been a few years I've been here, you feel like you have grown versus people kind of back home, just because you're on a different
Of
journey
course,
and
yeah.
they're probably growing in a different
Mhm.
aspect. But where you're at, you feel so. What was helpful for me, or what I felt really helped me, is that I kind of went there and tried to really live this student life in Hungary,
Mhm.
try to be part of their traditions, try to kind of see what that country has to
Yeah.
offer. Of course, my family did want me to fly back and see them every Christmas holidays and
Of course, yeah.
every summer. But I tried my best to kind of be there and be present there in there. I made friends outside of school. I was able to find also some Iraqi Hungarian friends, and so it was nice. You meet people from you meet people through the Hassaniya
Of course,
there. We
yeah.
had a small little majlis that was taken care of by a very nice gentleman. So all of those things that you kind of want to hold on to, whatever identity that you have, because you're always at risk of losing it, of losing, yeah. And that's, I think, some challenges that people are afraid of leaving home, is
Yeah.
that, okay, well, if I left home, what will happen to who I am? Like, will I change? Will I be someone else? Will I lose my ways? Will I have to change the person I am? So that's a little bit of a
A
challenges.
little bit of an internal battle going on, you don't know, yeah.
Exactly.
No,
Exactly. Yeah.
100%. That's a big thing, but networking is a big thing as well, right? So,
Hmm.
you said, like, kind of stepping out of your comfort zone. You might not be the person who doesn't usually, maybe the invitee to the majalis, to the functions, to the,
Hmm.
the hangouts, the FIFA parties, whatever it be. But now you gotta kind of switch gears and become the initiator and become
Yeah.
the person who invites, or hey, let's have a coffee date, sit down and get to know people. And I know a lot of people might struggle with that, especially the first time, like, how am I supposed to do this?
Yes. Yeah.
Yeah, my name is
Yeah.
right. So it's
Exactly.
like sometimes a little
Exactly.
bit difficult, but
Yeah.
I remember having a conversation with another guest who was on here before, and we were talking about networking. How do you kind of break the ice? The first step. How do you kind of just figure out how to do it?
Hmm.
And we came to a kind of pretty good idea where it's like, we go to the Friday programs or Saturday programs at Sani, and a lot of times we see people we do not know. So
Yes.
why not just make it a goal that every week or every month you introduce yourself and meet a new person, right?
Yes.
That's,
Yes.
get their number, see who they are. You never know, might be a great relationship or a network that'll kind of have a full circle moment and you guys end up working and breaking bread together in the future.
Yeah.
Or you might just make a new best friend, someone who
Exactly.
will invite you again to the
Yes.
FIFA parties, right?
Yes,
So you never know. And
exactly.
that's a big thing.
Yeah, because again, because when you meet someone at Destiny, you share one thing
Yeah.
with them. So again, if you try to find like any common grounds in there, you could connect. And that's the beauty about it, is that you could connect with someone from a different part of the world, from a different
Yeah.
religion, from a different mentality, and yet you connect with them and you end up finding that they're much more similar
Hmm.
to people that you know back from your own
Of
community and
course.
all
Yeah.
of that. So, and that's like that's what you have in common is being human. What common you have is that the kindness that you share, the generosity that you share. So, it's again, it's these things that, because they're challenging and then you go through them, then you end up with really good people that you find and that you add to your circle, that end up becoming part of your kind of immortal circle, where you, even when you move back or you move away, you stay close to them. and I do have many people that I met in from school that I still people that I
Yeah.
check in on a regular basis. Yeah.
Yeah, 5 years is a long time, man. I mean, it
Mm-hmm.
flies by quick, but, you guys struggled together, you broke bread together, so it's
Exactly.
those are
And it's
relationships that's
also,
they
yeah,
last.
and that age is also the age where you become who you are.
Yep.
You become the personality that you are. So you feel like yeah, there's a bigger sense of you in that area, in that country. So it holds a very special place.
There you go, man, that's perfect. Now I'm gonna ask you a hard question. That question is, if you're able to start over again
Hmm.
from the beginning, you're 19 years old again, you haven't started anything yet, you're still deciding, should I leave, should I stay? Would you pursue the same career over again, same pathway, or would you go to a completely different career?
So
I know it's a little
knowing
difficult.
who I
Yeah, knowing who you are
knowing
right
what,
now, would
yes,
you have made a change?
I believe I would have done
Same thing again?
the same steps as well. Just because of very every path, like any turn in the path, what kind of created who I am, and I think it was overall a more, let's call it, um, like less risky, I would say,
Mhm.
because it kind of going and studying in Europe does in a way open kind of a path to work elsewhere
Of course,
as
yeah.
well. So yeah, of course the plan is to come back to Canada because this is my home and this is where I want to be, and the kind of dentistry that is offered in Canada is the kind of dentistry that aligns with me very well. So that was my goal, my like top priority, or top choice. But at the same time, if that did not work out, and then I do still have a lot of options where I could work in and stay in Europe and work in
Mhm.
Europe because I did graduate from a European school, or go to back home, go to our countries, to the Arab countries or areas in Asia. So that's why I think I would still take the route, and then becoming a dentist and seeing what kind of work it is or what kind of
Mhm.
life it is. There is a lot of satisfaction that I find in it. So it that kind of feeds that whole where am I? What am I
Yeah.
doing? What's my purpose? All of those kind of things. So it does fulfill me from that way, and I do like it as a profession because you could always be better. You could always do better. You
Yep.
could even if you don't expand to doing more things, that same thing that you might do every day, there is a way for you to perfect it, to reduce the amount of errors that you do because you're just doing procedures. The whole work is procedures. The whole work is dealing with something. So there is success and there is failure and there is doing it perfectly and
Yep.
or like in an acceptable. You could grade everything you do. You could literally grade it. So if it could be graded, it means that you could always get a better grade or get the perfect
Yep.
mark. So that's what I feel kind of gets me to go and do more courses, learn more things, learn about new things, and all of that.
Inshallah, yeah.
Because the same thing that it was like the same thing that I am doing, whether it is like that basic filling on a tooth, there is 100 ways of doing it, and every way to there are ways to do it, systems that you could put in place to increase the success and
Mhm.
reduce the the failure rate. And even if your failure rate is very low, once you have a career and it's like 10 years, 20 years, 30 careers, even if it's a very low percentage, it could still happen
Yep.
to three, four, five people. And to those three, four, five people, that's like could have been the worst thing that could happen,
Yep.
something failing in their mind. So if it's in my hand to do a better thing, because you could always be like, oh, well, I did my best. And then if it doesn't work out, it doesn't work out. But did you really do your best? Did you do your best in trying to do your best to equip yourself to do the best way? So that I feel because it's in that profession that could push you to strive and be a little bit better. I want to be in that kind of profession. I want to be in a profession where I could work on myself constantly and do better. And I think dentistry is one kind of profession that I would do. So to me, at that time, it was the most plausible
Yeah.
choice going to Hungary. We were talking about this early before we started recording about that you when you're sitting down and looking at what possibilities can happen,
Yeah.
there are a million ways
Could
that
go
it could
wrong,
go
right, left,
could
center, you
go,
never
and
know,
then you
yeah.
could live all like a million
Mhm.
different ways. But when you actually take the first step, you are sometimes most of the times are left with two choices, like which route to take, this side
Yeah.
or this side, right or left. And sometimes when you just follow it step by step and just start that journey and take that first step, those as you take those steps, it comes very clear to you what you'll end up doing. If you're not on that escalator yet, then you see it could go to a million ways. But
Yeah.
if once you take that step, there's only one next step that you could take, whether it's right or left. There's
Yeah.
not a thousand possibilities every time. And Hungary, or going to Europe, going to a country that offers a program, that's the most important thing. It
Yeah.
needs to be a country that offers a program that is recognized by Canada. And then once you graduate from that, whether whichever continent it is from, you bring that degree and start that process. So I when I was through that process, I was working alongside people from all different part of the world, from Brazil all the way to China, and so there was a lot of places. So in my case, that made sense. I had a little bit of familiarity. I had some kind of an idea that yes, this is a way. But so I would probably take the same route, go to somewhere and then come back. And it worked out in my advantage because it ended up being less years than I would if I would have stayed here the traditional way. Um, but and there was also the journey of kind of being far from home and like building
Yeah.
yourself as a person, like an independent person. So that I feel helped me become a person who I am, in how I am, like in the life that I kind of lead.
No, 100%. I mean, the journey itself builds character too. It's like
Yes,
you build so much character. You know, you're out there alone. You gotta be the initiator. You gotta figure things out on your own, right? And you're being far from family is not easy. You know,
yes,
especially if you're
definitely.
Arab families. You
Yes,
know, anything happens, you don't answer the phone. خلاص راح ولادي. He's
of
gone,
course.
right? You know,
Yes,
that's I know how
yeah,
it is, man.
yeah.
It's,
You cannot.
you have to answer every message,
You
answer every
can't. Yeah,
call.
missed calls are not allowed.
Oh,
Yeah.
man, it's crazy out there. No, alhamdulillah, I'm happy it worked out, and you know, I can see how passionate you are about it as well, which is always exciting. You know, when someone's passionate, you feel that energy, and alhamdulillah, and inshallah, I'm sure you're successful, and more. I wish you more success,
Thank
inshallah,
you.
and
Thank you.
hopefully one day I'll come on the chair there, and I'll get a full therapy session from you.
Yes, for
Oh,
actually, if I think you're traumatized and we can't start at the chair, we have to sit across each other on a normal chair first
so coffee
before.
date.
Yes,
There
coffee
you
date
go.
first.
Yeah,
Decaf for you, because if you're a bit anxious and you get caffeine, you'll
yeah, I
get the
might get a little too
jitters.
excited, huh?
Yeah,
Yeah, no,
yeah. No,
okay,
but what you said about the passion, I think
yeah,
it's that's a part of the field that I like, is that you could always learn new things. As a general dentist, if you haven't specialized in
yeah,
something, you could do very different kind of procedures, help different kind of people for different needs. Whereas whether it's pain management, whether it is elective work, or whatever it is cosmetic
yeah, yeah,
work. So it's every every kind of path, or every department that you work in, there is new things for you to learn, and learning something new is nerve wracking.
oh yeah,
Kind of puts a little knot in your stomach, but after you try it, you do it. It might work, it might not work, but then you do it few times, then you're like, it's something new, it's a new skill that you built. And that's something nice about this profession, is that you could kind of keep, even we're talking about being better
Yeah.
at what you normally do, or you could learn something new and train your brain to do a new thing, train your brain and hands to do something new. And that path of still learning, but at the same time being able to apply what you
Yeah.
learn, that there is this a little bit of like it does feed your passion. So
Oh, that's
that's
beautiful.
really
Yeah,
nice.
work with
Yeah.
your hands too is always a
Yeah.
great thing. You kind of see your work in front of you get complete, and you
Yes.
feel satisfied. Like,
Yes.
Alhamdulillah, I got this
Yes.
done.
Well, you come from a family of artists, so you know what it means when
Eh,
you can create a piece,
My
right?
grandpa, he loves art. My mom's an artist. I hate art. I
Oh
can't.
no
No,
way.
I've just been because at such a young age, I've just been like, everywhere I go, art this,
Yes.
art that, and then
Yes.
my grandpa, do you have to become artist too? Do you have to? I'm like, for me, it's like there's only a couple pieces of art that I genuinely really like that
Yes.
my grandpa made, my mom. Otherwise, like wherever I go, I see art. I'm like, man, I've
Yeah.
seen so much of it throughout my whole life.
For sure.
I'm okay. I'm
Yes.
full from
Yes.
it, so it's all good. But of course, art is not just painting itself. Like what you do as well. That's a certain art.
Mhm.
Cooking is
Yeah.
an art, and what you do as a dentist is an art as well. You're graving. You gotta make sure it's really
Yes.
precise. The drill is so tiny. A tooth is so tiny, right? So that's
Yes.
great to see what you're
Yeah,
working with.
and in dentistry, you do work in a very small field, and so it's this very like it's short bursts of very intensified like focus in one area. So it's like it is an exercise for the mind where you have to do like that hand eye
Yeah,
coordination procedure that you need to do, but also at the same time be aware of everything else around you as well.
that sounds nerve wracking, man. Like you gotta
Yeah.
have nerves of steel right there. You
Well,
gotta.
that's it's that's why even the easiest thing
Yeah.
procedure that you could do, where the setting you're doing it might make it the most difficult one, that kind of not in your stomach. You could get it on a routine filling that you
Hmm.
do maybe 1,000 times, but it's on who you're doing,
Hmm.
on if there it's a moving target, if it's
Yeah.
someone that is
It's not throwing punches
afraid.
like me.
You get bit on, you
Yeah.
get
Oh
your
my
fingers
god.
bit, you get all of
Yeah.
those kind of things. I've had someone pull my shirt once
Yeah.
from pain, all of that. So you do get
Yeah.
that. So it's all again managing, again being focused, but also managing the environment, managing the patient,
Hmm.
managing the kind of the everything else, all these curveballs. So it is an exercise for the brain. So that's why you see a lot of dentists working maximum 4 days a week, because
Yeah.
you do need that break. And when you're very focused, naturally your body tenses.
Yeah.
Naturally your body is in a more sympathetic mode. So you're like it's if you're haven't given your mental health, your physical health a lot of care and
Yeah.
maintenance, like every time you're stressed, your cortisol level is up, it will trigger or irritate the part in you that's not doing
Yeah.
very well. Whether it is a disc in your back, or
Hmm.
whether it is a tick where you have to like bite the inside of your lip,
Yeah.
anywhere where
No.
you
Yeah.
have something. So that's why lots of people do not enjoy being in that making their job with them, because we have people that come to the chair and they're like, when I'm at work I'm stressed and I'm just like grinding my
Yeah.
teeth. So it is not their teeth, and it is not, it's probably their work, but it's also, it is that's the weakest part in their body that gets affected the most
Yeah.
by stress. And it could be your job, it could be your mother-in-law,
Yeah. It
or
could be anything. It could be
it
anything
could be
happening at home.
your
Yeah.
child, it could be anything.
Yeah.
So it's so you do have to find some way for you to diffuse
Yeah.
kind of the tension, or kind of release it somewhere, release it either kind of come to work where you're not charged, so you could endure and let all that kind of stress kind of
Yeah.
go through you. But you need to find a way to pass that,
Release it. No.
to release that. And that could be that's the other part of your journey, is finding how are you going
Yeah.
to come back the next morning feeling as good and feeling as fresh, because you can't be like a candle, and when you're as soon as you graduate, you're a long strong candle, but you're
And it
just
just melts, yeah.
burning low until the time you retire, and you're like, that's it, you drop your handpiece for the last time, and you're like, I don't want to see a mouth anymore. It can't be like
Yeah,
that.
yeah.
You need to switch, you need to be an electric,
Yeah,
or like you can't be a burning candle. You need to just maybe have a lower light. You don't need to go full and meet your and that's the difficult part, is that are you going to say no to a job that offers 5 days and go 4 days and earn
yeah,
less money or all of that? um but if you're not finding a way to refuel your gas, then there is the profession becomes very stressful. The Then managing the business side of it
yeah.
becomes very more
Everything just feels chaotic at that point, right? Because it's just
exactly.
mental health is a big thing, and just keeping your, as you said, having an outlet, just kind of release.
Yes.
Mental health professionals, they always, doctors. You're a doctor as well. You are a
Thank
doctor.
you.
You're
Thank
also in
you.
there. You're getting punched. You're
Yes.
getting bitten as well. And you have to be professional. You have to be able to handle it in a professional manner and take care of
Yes.
the patient in front of you, because that's your job.
Yes.
But finding that outlet to take care of your mental health, and then also making sure your body is also healthy as well, so you could withstand standing up and take care of that stuff. Nutrition is probably a big thing for you as well, to make sure you're eating all the right
Yes.
stuff.
Yeah. Nutrition is very important. Sleep is very
Yeah,
important. And seeing what kind of, I think, given your physicality, or how tall or
yeah.
how short or how heavy or how slim you are, when you're doing that laborious work, it kind of puts load on a certain area, whether it
Mhm.
is your neck, whether it's your back or your shoulder. So finding out what needs more care and finding out what works for you. Do you need to stretch? Do you need physio? Do you need all of that? Or do you need to invest in equipment that
Yeah,
helps, work more ergonomic equipment? You do need, again, you need to take care of yourself in order for you to come back, because at least what you had, like your mission is you go and do good work. And for me, it's kind of like playing a racket sport. Sometimes it's not about getting the point,
yeah.
it's about reducing the mistakes, because half of the points that your opponent gets is from your mistakes. So
Mhm.
if I work so hard on reducing the mistakes, that again is, that's more things that sometimes in my control. And that's how it is, because sometimes you do have difficult patients that coming in, or different situations, or there are different things on your mind that are very like putting, like there is something on your mind, so
Yeah,
you cannot be fully kind of present in when you're at work. So what you do, what do you need to keep doing on a daily basis in order for you to be the best version of yourself every day,
yeah. No,
just to offer the best kind of treatment. So
yeah,
and I think that is part of the journey. Part of the journey is seeing what works for you, and it's sometimes it's things that keep changing, depending on how, where your life is, where your
yeah.
work is, what's your schedule like. You might need to adapt to the new you, and find what works for you. And that's how, very kind of when you're an established dentist, where you can kind of pick and choose what kind of work you need to do, or what you
Mhm.
kind of work you like to do, or what kind of people you like to see, end up specializing, or limiting their practice to only one kind of, or not like to limiting to only um, one section of
Yeah,
dentistry, just because that's what they found works for them. That's what they found ends up causing them. So we have a lot of dentists that do not see kids. We have a lot of dentists that do not see cosmetic cases. People that don't see surgical cases.
mhm.
Like you could choose to not
Yeah,
see anyone. Like we like there are many dentists in the city, and you don't need to be everyone's dentist. So there is a very beautiful relationship among peers in the industry, where there is referrals, where you could, the specialist would the specialists in our the dental community give do a lot a service to the general dentist because they take the difficult cases, the difficult patients,
Yeah.
they help and people that need the extra care. So a big part of that is knowing your limitations, knowing where who you will kind of who's going to be someone that you could deliver, you could meet their expectations. But when you're starting off, when you're a young dentist, you want to do everything. You were like, I could fix this or I could
You're
do
excited
this.
too.
You're
You're fresh out
excited.
of school. You just want to start working, right? Yeah.
Exactly. So in the beginning, you see everything. You're okay to work Saturdays. You're okay to work and like late
Give me
shift.
7 days a week. I'll do it,
Yes, exactly,
right?
exactly. Then later
Yeah.
on, but that's and again, that's where because the
Yeah.
profession could offer you some kind of stability and some
Yeah.
financial stability. Then later on, you could choose. You could literally choose, and you could just do one thing only and limit your practice to one thing. Have find the right team that kind of supports you and
Yeah.
have the same ideology as you and take and then do the only things that make you happy.
Now, here's another tricky one.
Okay.
AI.
Yes.
How is that affecting the dental industry? Like, is this something that you're seeing affecting you similarly when it comes to affecting like family doctors per se? A lot of people they search up all their symptoms on
Yes.
GPT or whatever it be, or even Google, and like they go to the doctor. Doctor, I
Yes.
need this medication, this dosage because I'm suffering from this illness.
Yes.
Yeah, take 3 steps back. What's going on, right?
That's true. That's
Are
true.
you suffering? Do you see not suffering, but are you seeing the same type of cases where people might come in and they're 100% sure they have a certain thing going on, and that's the only problem they have because you
Mhm.
know Hajj GPT, Doctor GPT,
Yes.
Dentist GPT, Sheikh GPT, Ayatollah
Yes.
GPT said this is the case and this is
Yes,
what it is.
yes, yes. Honestly, I do have sometimes these cases where some
Yeah,
people have searched up their symptoms, done a little bit of a research. To be honest, these people can be managed
yeah,
sometimes very well because they are invested. They know
mhm,
at least a little bit. It's different when they trust what they saw online
yeah,
and don't trust you until you prove them wrong.
mhm,
That's a different person. That's a difficult person. That's a person that will suck energy
yeah,
out of you and even just have a conversation with. But some people that go and search their symptoms, have logged some symptoms, give yourself a little bit of option. I feel like they're they're more kind of invested in the treatment or they won't want to know the best. So I feel like if you follow the logic
yeah,
and explain to them and show them what is going on or explain to them a test and what a positive test versus a negative test mean, then they will end up kind of following you.
yeah,
Back to your AI question, I think it's conserved the industry in many ways. So far we have it helping us with radiographs, so X-rays, reading X-rays.
mhm,
Of course, it doesn't give the ultimate diagnosis, but it will indicate to if there is kind of this shadowing may mean this, and you could feed it small X-rays, two-dimensional X-rays, three-dimensional X-rays, and it could give you a report. It could give you a report on what it can be. So these can sometimes help the dentist identify
mhm,
things that might have like they might skip. It's of course just like the internet, just like any invention. If you take it and try to get more out of
yeah,
it, or trust it, or kind of leave any human kind of supervision around it, it might end up causing some harm.
yeah.
But I think it could you could take it as an asset.
As a
There's a lot
tool,
of
just
yes,
you have
exactly.
lots of tools in front of you, and just take advantage of it.
Yes,
Don't hold on to it.
exactly.
Say this is it.
Yes,
You know.
exactly. Because so it could help with diagnosis. It could
Yeah,
help with record taking or record analysis.
yeah,
Because instead of now when we have patients come in, we take X-rays,
yeah,
we do gum measurements, we take some photographs, and then we have to kind of analyze it and see what kind of patient they are,
yeah,
what kind of what kind of risk they carry, what kind of risk they could have to gum issues, cavities, or even what are the risk of things breaking, what are the things
Yeah,
of the teeth wearing out a little bit more. So there could be an AI algorithm that could help with this analysis.
no, that's good. No,
Hmm.
mashallah, that's it's good to hear that your GPT, AI, whatever it be, taking advantage of the tool is a great thing. You know, even students using it the right way is a good thing as well,
Hmm.
rather than just, hey, rewrite my essay and I'll take care of it later, or do this
Yeah,
assignment for me. But kind of just making sure that your work is thorough. Hey, can you just double check the grammar, or things like that helps out. Now,
exactly. Yeah, and
with
then also the other ways
yeah,
you could have a lot of now AI is entering in becoming in the practice management or the reception where you could kind of call, change your appointment,
yeah,
all of that. That could kind of help a
it does
lot.
help a lot, especially busy dentist office. Obviously, they get a lot of calls too. So sometimes you're trying to reach and you can't reach. Even doctor offices, a lot of times try to
Yes.
call and you can't reach because everyone's calling. But having the extra hand goes a long way.
Yeah. You just need to press six many times to speak to a live
Oh my
person.
god, how many times can I press six? Three times 666. That's the devil's number. Stay away from that.
Yes.
So now, you spoke a lot about the actual part of becoming a dentist and what it takes to become a dentist. The skills you need, take care of your mental health, and take care of your physical health, and the journey itself. And now, want to ask more towards the business side of it.
Hmm.
Alhamdulillah, mashallah, you own a clinic and you're running a clinic, which is great. Now, how does that differ from being a dentist? Like, I know you're a dentist, but you're also a business owner. So where do they kind of correlate together? Where are some places where you got to separate yourself from the dental side and you got to be like, hey, I'm a business owner right now. I sit on this seat
Yes.
compared to when you're, helping out patients.
That's yeah. It's once you become a dentist and also an owner, then
Yeah.
you are a business owner at the same time as you're a dentist. So you
Yeah.
would need to be versatile in changing roles and then moving from being a dentist and then being an owner. And sometimes they work with
Yeah.
each other, and sometimes it's difficult to be both at the same time. So back to us talking about you're working in a small field. Anything there's a many things on that you're kind of worrying about and talking about, but then you'll have a staff member come to you because there's an issue somewhere or
Yeah.
there's something that's not working or someone cannot come to work today or all of those kinds. So again, you need to be able to differentiate. One way that I found very helpful for me is that I kind of look at myself as I was hired by my clinic in order to run it, that it is not my clinic.
Yeah.
And that separation, although very easier said than done,
Yeah.
has served me many times where I'm not looking at it as every decision as is, this is me and this is my money and this is my
Hmm.
dollars and all of that. And I would sometimes consider myself, okay, well, imagine you're just the executive
Yeah.
manager of the business, and what you have to do is for the best of the business, not the best for the dentist, not the best for a certain staff member or a patient, and that sometimes helps. But usually, being the owner, being on the business side of it, is needs your attention outside of
Yeah.
the chair. So you do need to factor that in. You need to factor that, and it's not right to do it at home when you get like after a
Yeah.
day of work. So if you want to be also a business owner, you do need to take some time away from the chair to tend to your normal business
Yeah.
things, to take make sure that the staff are doing well, to make sure that the business is growing in a certain way, have a more of a like a plan or a vision for the business. Like you're imagine you have a dentist hired,
Yeah.
then you're just the owner.
Oh,
Yeah.
and work-life balance, I feel like kind of switches a lot as well. Especially when you're kind of, you're a dentist and you're also business now. When do I stop taking calls so my family gets off my back? When do I stop to, you got to make time for yourself, you got to
Hmm.
make time for your family, and you got to make time to make money and take care of the business as well.
Yeah.
That's life, and just maybe I feel like sometimes people underestimate that as well. Oh, I can handle it. It's okay. That's exciting. It's fun. It's great, but it comes with a lot of sacrifice as well, I believe.
Of course, yeah, and I feel like a big part of it is the when you're working in when it's your business and you are like wanting also the best for your business, sometimes it needs to come at the cost of the employee. Like the relationship between the employee and the employer is a very
Yeah.
complicated and difficult relationship because for the employer to do better, to make more money, the employee needs to work
Yeah.
harder and earn less.
Yeah.
Like so it's a very opposite relationship and all of that. So sometimes if you're both, if you're the owner and the employee, it makes it sometimes it is there is a struggle. But that's where you when you find your boundaries, find that this is the time that you could spend some time for work, but this is when you need to spend time away,
Yeah.
or you need to take a break. It's important to make those decisions and early on, because again, if you get used to working overtime or working more or not setting boundaries, it's harder to do that later.
100%. And I've taken so much of your time. This has been I'm
It's a
enjoying
beautiful
this
conversation. Yes,
I'm enjoying this conversation a lot. Alhamdulillah, but I do feel like in order to give this everything justice, there has to be a part two somewhere in the near future,
I would love
inshallah,
to come back.
where we
Yeah.
could kind of maybe touch more base in terms of the business side and you know again, it's at the end of the day, it's a clinic, but it's also a business and giving your input about business and running a business, starting a business, how you kind of get started, what was your mindset, I have so many questions in my mind I want to ask, but I want to make sure we have a sit down where we just kind of just dedicate that conversation strictly to that,
Let's leave it
inshallah.
for
Let's
part two.
leave it for
Yeah.
part two, leave everyone on a cliffhanger, so get them a little excited. However, I'm gonna ask you one last question. I ask this question every guest who hops on. A crazy question, very difficult. You're gonna be thinking about it for maybe you're gonna be sleeping all night, like, man, I should have said something else, but it's okay. Whatever said is said here is said here. It just stays on
Okay.
YouTube.
Hit me. Yeah.
What's one piece of advice that you could leave our guests with? It could be a quote, it could be something someone told you in the past, it could be a hadith, it could be a verse from the Holy Quran. Completely up to you. Something that kind of you held on to throughout the years, throughout your journey that you kind of like to share with the viewers.
So I always think that it's like the harder you work,
Mhm.
the luckier you get. And I feel like just do find the thing that you want to do and work hard, work towards it. And then you'll get lucky and you'll get what you want. Whether it is that thing or you get
Mhm.
lucky and it's not what you
Yeah,
think you want. So work hard and you'll get luckier.
there you go. Work hard. High risk, high reward. Work hard, play hard. There you go. It's been an honor having you,
Thank you
Dr.
so much.
Said Dhia. Thank
Thank
you so much
you.
for
Thank
coming.
you.
And inshallah, we'll tune in next time in the near future.
Yes.
You let me know when you're free, and we'll make it happen. Thank you again, guys, for tuning in. Inshallah, we'll see you guys in the next 2 weeks with another exciting episode. This has been Dr. Said Dhia. And Alhamdulillah, catch you guys next time.